A strange tightness in the calf, a feeling of pressure that wouldn't fully go away. Not sharp enough to scare him, not painful enough to call a doctor, just uncomfortable, annoying, easy to ignore. He was 68 years old, he had high blood pressure, but he took his medication. His cholesterol was borderline, but manageable. He wasn't overweight, he didn't smoke anymore, and most importantly, he wasn't having chest pain. That's why he wasn't worried. That evening, as he sat in his living room watching television, he noticed his left leg felt heavier than the right. When he stood up, it felt slightly stiff. He even rolled up his pant leg to check. Maybe it looked a little swollen, maybe a little warmer to the touch. But he convinced himself it was nothing serious. Probably just circulation, he said. Maybe I've been sitting too long. I'll stretch it out tomorrow. He went to bed. Sometime in the early hours of the morning, his heart stopped. Doctors later explained that the warning sign had likely started earlier, not in his chest, but in his leg. A circulation issue. Possibly a developing clot, a disruption in blood flow that can quietly strain the heart or travel through the bloodstream with devastating consequences. And this is the part most people don't realize. The body doesn't always send dramatic warnings, especially after 60. It whispers, it sends small signals. Subtle swelling in one leg, persistent calf tightness that feels different. Warm skin on one side, a dull ache that doesn't behave like a normal muscle cramp. Many people wait for crushing chest pain before they take heart health seriously. But sometimes the first sign doesn't come from your chest at all. If you are over 60, if you have high blood pressure, diabetes, high cholesterol, or you spend long hours sitting, this is something you need to understand clearly. Tonight, we're going to talk about the silent leg warning that many people dismiss, how it can be connected to your heart, and when it becomes dangerous. One of the most overlooked warning signs in older adults begins with something that feels completely ordinary: leg discomfort. Not severe pain, not an injury, just a sensation that feels slightly unusual, a heaviness in one calf, a tightness that doesn't behave like a typical muscle cramp, a swelling that seems minor but appears on one side more than the other. Many people over 60 dismiss this immediately. They assume it is aging. They blame arthritis, poor sleep, dehydration, or simply sitting too long. The problem is not that every leg ache is dangerous. The problem is that some of them are early circulation warnings that should never be ignored. As we age, our blood vessels naturally lose some flexibility. Arteries can narrow over time due to plaque buildup. Blood flow can slow, especially in the lower extremities. If someone has high blood pressure, diabetes, elevated cholesterol, or a history of smoking, the risk increases significantly. Reduced circulation in the legs can sometimes signal peripheral artery disease, which is more than just a leg condition. It is often a reflection of what is happening throughout the entire cardiovascular system. When arteries in the legs are narrowing, it is very possible that arteries supplying the heart are also under stress. There is also another serious possibility that many people don't consider. A blood clot can form in the deep veins of the leg, a condition known as deep vein thrombosis. This can cause swelling in one leg, warmth, redness, or a persistent ache in the calf. Some clots cause intense pain, but others create only mild discomfort. That is what makes them so dangerous. If part of that clot travels through the bloodstream, it can block circulation in the lungs or put sudden strain on the heart. The person may have felt only a tight calf the night before, never realizing that something more serious was developing quietly. What makes this especially concerning for seniors is that symptoms can be subtle and easy to rationalize away. A leg that feels heavier at night, a sock leaving a deeper mark on one side, skin that feels slightly warmer than usual. None of these feel dramatic. None of them create panic. But the body does not always scream before a crisis. Often it whispers. Circulation changes in the legs may reflect stress on the heart, reduced oxygen delivery, or early vascular disease. This is why it is important to pay attention to patterns rather than isolated sensations. If discomfort in the leg keeps returning, if one side consistently swells more than the other, if walking produces unusual fatigue or cramping that improves with rest, these are not things to brush aside automatically. They are signals that deserve evaluation, especially in adults over 60 with existing cardiovascular risk factors. Recognizing that the legs and the heart are part of the same continuous circulation system changes how we interpret these early warnings and can be the difference between prevention and emergency interventions. Another critical point many people overlook is how heart-related events often develop silently, especially during the night. We tend to associate heart attacks with dramatic symptoms, intense chest pain, sudden collapse, visible distress, but in adults over 60, particularly those with diabetes or long-standing high blood pressure, the warning signs can be far less obvious. The body may show signs of strain in subtle ways hours or even days before a serious cardiac event occurs. Circulation changes, mild fatigue, unusual shortness of breath during routine activities, or unexplained discomfort in areas like the back, jaw, or legs can all reflect underlying cardiovascular stress. During sleep, the body shifts into a different physiological state. Blood pressure patterns change, heart rate slows, hormonal levels fluctuate. In some individuals with narrowed arteries or unstable plaque buildup, these natural shifts can trigger reduced blood flow to the heart muscle. If circulation is already compromised due to vascular disease elsewhere in the body, including the legs, the heart may be operating under more strain than a person realizes. This is why some heart attacks occur in the early morning hours. The person may have gone to bed feeling relatively normal, unaware that their cardiovascular system was already under pressure. There is also the issue of reduced symptom awareness. Many older adults attribute mild discomfort to aging. They normalize fatigue. They dismiss swelling. They downplay subtle changes because they do not want to overreact. This mindset can delay evaluation of early heart strain. When circulation becomes inefficient, the heart has to work harder to push blood through narrowed vessels. Over time, this increased workload can destabilize plaque in the coronary arteries, increasing the risk of a blockage. Sometimes the final event appears sudden, but the process has been developing quietly. Another important factor is diabetes, which can blunt pain signals. Individuals with diabetic neuropathy may not feel classic chest pain even during a heart attack. Instead, they might experience vague symptoms such as nausea, mild sweating, lightheadedness, or a sense that something feels off. In some cases, the only noticeable sign before a nighttime cardiac event may have been earlier subtle circulation changes, including leg discomfort or swelling that seemed unrelated at the time. Understanding this connection changes how we interpret warning signs. The cardiovascular system is interconnected. Arteries supplying the legs, brain, and heart are all part of the same network. If one region shows reduced flow or vascular disease, it often reflects a broader pattern. That is why healthcare providers consider leg circulation symptoms a potential marker of systemic cardiovascular risk. Paying attention to small changes before bedtime, especially persistent or one-sided symptoms, can prompt earlier evaluation and testing, which may include ultrasound imaging, stress testing, or blood work to assess clotting and cholesterol status. A third critical element to understand is the difference between an ordinary muscle issue and a circulation-related warning. Many people assume that if pain improves with stretching or massage, it must be muscular. While that is often true, circulation problems do not always present with sharp or intense pain. Instead, they tend to produce patterns. For example, discomfort that appears after walking a short distance and improves with rest may indicate reduced arterial blood flow to the legs. This is sometimes described as a cramping or tight sensation that predictably returns with activity. It is not simply soreness from overuse. It reflects muscles not receiving enough oxygen-rich blood during exertion. Another pattern involves swelling that affects only one leg. Fluid retention from general causes such as high salt intake or certain medications usually affects both legs fairly evenly. When one calf is noticeably more swollen than the other, especially if it feels warm or tender to the touch, that imbalance deserves attention. The difference may seem small at first. A tighter pant leg, a sock imprint that lingers longer on one side. These small asymmetries can indicate a deeper vascular issue, including venous blockage or clot formation. Even without severe pain, the presence of one-sided swelling should not be ignored in adults with cardiovascular risk factors. Color changes are another subtle clue. Pale bluish or slightly reddish skin on one leg compared to the other may signal altered blood flow. Some individuals notice that one foot feels consistently colder. Others observe that small cuts or bruises on one leg take longer to heal. These are signs that circulation may not be optimal. When arteries narrow, tissues receive less oxygen and nutrients. Over time, this can increase strain not only on the local area but also on the heart, which must pump harder to compensate for resistance within the vessels. It is also important to consider timing. Muscle cramps often occur after intense activity or dehydration and typically resolve within minutes to hours. Circulation-related discomfort may persist, recur regularly, or gradually worsen over days. It may not respond fully to hydration or stretching. Paying attention to how symptoms behave over time provides valuable information. If discomfort is becoming more frequent, more intense, or appearing with less activity than before, this shift should prompt medical evaluation rather than continued self-treatment. Risk factors further guide interpretation. Individuals over 60 with high blood pressure, diabetes, elevated cholesterol, a history of smoking, or known vascular disease should approach persistent leg symptoms with greater caution. These conditions accelerate arterial narrowing and increase clotting risk. Even a seemingly mild symptom can carry more significance in this context. Healthcare providers may recommend non-invasive tests such as ankle brachial index measurements, Doppler ultrasound, or vascular imaging to assess blood flow. Understanding these distinctions empowers individuals to recognize when something is likely benign and when it warrants professional assessment, helping prevent the progression of underlying cardiovascular disease and reducing the risk of unexpected complication. Another important factor many people overlook is how lifestyle patterns quietly increase cardiovascular strain over time, making subtle warning signs more significant than they appear. Long periods of sitting, especially in older adults, slow circulation in the lower body. Blood pools more easily in the legs when muscles are inactive for hours. This stagnation can increase the risk of clot formation, particularly in individuals who already have thickened arteries or impaired vein function. Retirement, limited mobility, long television hours, or extended travel without movement all contribute to this reduced circulation pattern. What feels like normal stiffness after sitting may sometimes reflect deeper vascular sluggishness. Dehydration is another underestimated contributor. As people age, their sense of thirst often decreases. Many seniors drink less fluid than their bodies require. When hydration levels drop, blood can become slightly more concentrated, which may increase clotting tendency in susceptible individuals. Combined with inactivity, this creates a situation where circulation in the legs becomes even more compromised. A mild calf tightness after a sedentary day may not simply be muscle fatigue. It can be the body signaling that blood flow is not moving as efficiently as it should. Chronic conditions compound this effect. High blood pressure damages artery walls over time, making them less flexible and more prone to plaque buildup. Elevated cholesterol contributes to narrowing of vessels throughout the body, not only in the heart. Diabetes affects both large and small blood vessels, impairing circulation and healing. When these factors are present, even subtle leg discomfort should be interpreted within a broader cardiovascular context. The legs are often the first place reduced blood flow becomes noticeable because they are the farthest point from the heart and rely heavily on healthy vessels to maintain proper oxygen delivery. Sleep patterns also influence cardiovascular stress. Obstructive sleep apnea, which is common in older adults, causes repeated drops in oxygen levels during the night. This places strain on the heart and can worsen existing vascular disease. Someone experiencing leg discomfort in the evening may already have circulation under stress, and nighttime oxygen fluctuations may further challenge the heart's ability to maintain stable rhythm and blood flow. This combination increases the risk of cardiac events during sleep, especially when vascular disease is present but undiagnosed. Preventive habits play a critical role in reducing this cumulative risk. Regular gentle walking encourages blood flow and strengthens vascular function. Staying hydrated supports proper circulation. Managing blood pressure, cholesterol, and blood sugar through medication and diet protects artery health. Even small daily actions, such as standing and moving every hour, can significantly reduce blood pooling in the legs. Paying attention to persistent or recurring symptoms rather than dismissing them as simple aging allows earlier detection of problems that are far easier to manage before they escalate into emergencies. Understanding how everyday habits influence circulation reframes leg discomfort not as an isolated annoyance, but as a potential reflection of overall cardiovascular health, encouraging proactive care that supports both mobility and heart function over the long term. The final and most important element is knowing when to act. Awareness without action does not protect the heart. Many serious outcomes occur not because warning signs were absent, but because they were minimized. Adults over 60 often hesitate to seek medical advice for symptoms that feel small. They worry about overreacting. They do not want to inconvenience family members. They assume the discomfort will fade on its own. But when it comes to circulation and heart health, early evaluation can prevent irreversible damage. If leg swelling appears suddenly, especially in one leg only, and is accompanied by warmth, tenderness, or skin color changes, medical attention should not be delayed. If calf tightness becomes persistent, worsens over days, or begins to occur with less activity than before, it deserves assessment. If leg discomfort is paired with unusual fatigue, shortness of breath, chest pressure, lightheadedness, or unexplained sweating, these combined symptoms require urgent care. The body often gives layered signals. Paying attention to clusters rather than isolated sensations improves safety. Routine checkups also serve as a powerful prevention tool. Many circulation problems can be detected through simple, non-invasive testing. Blood pressure measurement, cholesterol panels, blood sugar evaluation, and vascular assessments help identify risk before symptoms escalate. An ankle brachial index test can compare blood pressure in the ankle and arm to evaluate arterial narrowing. Doppler ultrasound can detect blood flow issues or clots. These tests are not dramatic, and they are often available through primary care providers or vascular specialists. Medication adherence is another key component. Blood pressure medications, cholesterol-lowering agents, antiplatelet therapy, or anticoagulants may be prescribed to reduce clot risk and protect arterial health. Skipping doses or stopping medication without medical guidance increases vulnerability. Lifestyle changes complement treatment. A heart-supportive diet low in excess sodium and saturated fats supports vessel integrity. Regular moderate movement keeps circulation active. Smoking cessation dramatically improves vascular function even later in life. Family communication also matters. Sharing new or unusual symptoms with loved ones ensures someone else is aware if patterns worsen. In some cases, family members notice subtle changes before the individual recognizes their significance. Building a culture of openness around health reduces the tendency to conceal discomfort out of pride or fear. Most importantly, trust changes in your body. If something feels different, persistent, or unusual compared to your normal baseline, it deserves attention. The goal is not anxiety, but informed vigilance. Circulation connects every part of the body to the heart. When the legs send repeated signals, they may be reflecting broader cardiovascular strain. Acting early transforms a potential crisis into a manageable condition and supports the long-term protection of both mobility and heart health. The body rarely moves from perfectly fine to sudden crisis without passing through quieter stages first. Especially after 60, warning signs are often subtle. A leg that feels heavier than usual, swelling that favors one side, tightness that doesn't behave like an ordinary cramp. These are not reasons to panic, but they are reasons to pay attention. Your legs and your heart are connected by the same circulation system. When blood flow changes in one area, it can reflect stress elsewhere. Dismissing persistent symptoms as just aging can delay care that might prevent something far more serious. This is not about fear. It is about awareness. It is about recognizing patterns. It is about responding early rather than reacting late. If you notice new or unusual leg symptoms, especially alongside fatigue, shortness of breath, chest discomfort, or dizziness, do not wait. Speak with your healthcare provider, ask questions, request evaluation if something feels off. Early testing and treatment are far simpler than emergency intervention. Take care of your circulation daily, stay gently active, stay hydrated, manage blood pressure, cholesterol, and blood sugar carefully. Keep regular medical appointments. Small, consistent actions protect the heart over time. Most importantly, trust your instincts. You know your body better than anyone. If something feels different, that feeling deserves respect.